the dreaded select all that apply. You have to select all of the correct answers, so if you miss one, you miss the whole problem. That can produce some anxiety, but if you look at it this way, you're missing part of what makes a select all that apply question so easy. It's actually a form of a true or false question. Now granted, it's the same as 5 or 6 true or false questions, but you don't have to look at the question as a whole. You can look at it piece by piece. And true or false questions tend to be a little bit simpler. According to the NCSBN, multiple response items can require a candidate to select a single correct response, have more than one correct response, or require all responses to be correct. So this is a change just since December. And before that, we told everybody, at least one of them is going to be wrong, at least 2 of them are going to be correct, and that's just not true anymore. But this is still okay. You should still treat the question exactly the same as you always have. First, just read the question. Don't look at the answers. Read the question, figure out what you're being asked. Then read the first answer along with the stem as though it were a true-false question. Do that for each one of the 5 or 6 answer choices that you have. When you get more and more Sata questions, it generally means that you are doing well on your exam and that you're on the right track. An absence of them doesn't mean that you're not doing well, but the select all that apply questions tend to be a little bit more difficult, and so the better that you're doing, the adaptive testing tends to give you more of them. Let's look at a handful. A client with a recent cerebrovascular accident is on a dysphagia diet. What does the nurse do to ensure client safety while eating? So, if you look at this as a true-false question, is monitor the client while eating true or false? Well, the client has had a CVA and is on a dysphagia diet. True. You'll monitor while eating. Does the nurse need to feed the client? True or false? Well, it's false. Not everybody with a CVA or with a dysphagia diet needs to be fed. Does the nurse need to place the head of the bed at 90 degrees? That's true. Unless there's complicating factors, which would be in the stem of the question, then the nurse should place the head of the bed high so that the person with dysphagia can swallow well. Should the nurse check for pocketing of food? True or false? True. The client with dysphagia is prone to pocketing food and the nurse has to check for this. Does the nurse need to offer thinned liquids? Well, this is false. The client with a CVA on a dysphagia diet oftentimes shouldn't have thin liquids at all, but should have liquids that are specifically thickened. Let's look at the same question with different Sata options. Should the nurse have the family assist the client while eating? True or false? Well, false. Many family members aren't actually helpful to the client with dysphagia and don't understand that they need to eat more slowly. Does the nurse place the head of the bed in semi-fowlers? This is false. That is actually too far back for the client to eat safely. So the client with dysphagia needs to sit up more than semi-fowlers. Does the nurse have to feed the client? No. The client with a CVA on a dysphagia diet should be able to feed themselves in many instances. So unless the stem specifically indicates that the client is having increased difficulty, there's no need to feed them. Does the nurse offer thin liquids? Well, that's false. Should the nurse offer thickened liquids? True or false? That would be true. Let's look at one more set of options for this question. True or false? Does the nurse ensure a speech pathologist consult? True. The nurse wants to make sure that a speech pathologist, or otherwise known as speech therapy, comes in and assesses this client for diet orders, for special precautions, etc. Does the nurse monitor the client while eating? This is true. This doesn't mean that the nurse has to stay with the client. It doesn't mean that the nurse has to feed the client. It means that throughout the meal, the nurse should observe the client frequently to ensure that they are still swallowing safely, that they're not too tired to continue eating. Does the nurse place the head of the bed at 90 degrees? This is true. For the client with dysphagia, the safest sitting position is straight up. So unless there's contraindications, they should be straight as possible in the bed or in the chair. Should the nurse check for pocketing of food? This is true. clients with dysphagia often pocket food. Should the nurse offer thickened liquids, true or false? This is true. The nurse should offer thickened liquids, as these are easier to swallow. So, here's an instance where the select all that apply question has all true answers. Did that really make it any more difficult? No. If anything, it makes it easier because you have to evaluate each one for their own merit instead of worrying about which one isn't correct or which two are. You can evaluate each one for exactly what it's worth and not have to worry about any standard rules about how many will be correct and how many will be wrong. And we're here for you. We've got lots of practice questions. We're happy to help.